Dr. Schubel, thanks for joining me from Edward-Elmhurst Health. I appreciate it. You're a busy guy. We just wanted to check in with our local health provider for Naperville and kind of get an update. So give me an idea of where we are with the virus right now as of Friday, March 20th.
Yeah, I mean, we're seeing community spread. We're seeing multiple positive cases. I think the feeling in the health community is it's just kind of the tip of the iceberg. So we're starting to see more and more people with disease through our system. So that's kind of where we are. It's pretty. Our belief is it's pretty widespread already, and everybody should be following the precautions, staying home, and helping us try to prevent the spread.
I think lots of people are still a little confused with the difference between the coronavirus or COVID-19, flu and cold, because we can still get flu and cold during this time period.
That's absolutely true. It's part of the problem is it's really hard to tell the difference between those three illnesses. So it looks a lot like the flu. The most common symptoms we're seeing with COVID are a dry cough and fevers. The combination of those two things particularly are cluing us in. But it does cross over. Sometimes you'll have a little bit of a sore throat. Sometimes it's just mild URI symptoms. But the majority of the patients that we're seeing, I would say, have cough and fever.
What would be your advice? A lot of us who may have a cold or the flu immediately jump and think, oh my gosh, I have it. What if we're not feeling 100%, what should we be thinking about?
Well, it's in the community, so I think that people are going to get it. I think the thing to remember that most healthy people will probably do okay with it. So what we're asking is it's not necessarily needed to run and get tested, particularly because as we stand right now, the testing is still quite limited. So if you have symptoms, the key is not exposing anybody else. The majority of healthy people will recover. You got to follow standard treatment, which is stay home, stay isolated, stay well hydrated, Tylenol, and rest, and keep away from other people. So most people will get better with that. If you start having more serious symptoms, particularly shortness of breath, the problems that we see with sick COVID folks are more pneumonia-type symptoms, which is trouble breathing. Certainly any of that, come and see us, and that's what we're here for. But honestly, in the ER particularly, everybody with low-grade fevers and cough, most people, this treatment's going to be the same no matter whether we see you or not. And we don't have the ability at the point to test everybody.
All right. Well, good advice for certain. A lot of us are trying to heed all the precautions, but get a little confused that we're practicing safe distancing, but we worry that 6 feet's not enough. We're worried about surfaces. Where does this virus linger, and what should we be thinking about for that type of safety?
Yeah, it's not much different than flu transmission. Truthfully, it does linger on surfaces. That's probably one of the main ways people get it. It's on a surface. You touch the surface, and then you touch your mouth and your face. So good hand washing is where this usually begins and ends. So if you're doing frequent hand washing and you don't, so you're not touching your face in between that's going to be a key to transmission. 6 feet is about right. So it's respiratory droplets in the vast majority of circumstances, which means a 6 foot cone, is where what'll transfer. That's why the distancing is important, because even if people aren't having a ton of symptoms, it's still possible in that 6 foot or so cone to be potentially transmitted. So, good hand washing, covering your mouth with your cough, and staying isolated. I think that, what we're asking people now is to stay home around their family and not commingle. So that we have to try to slow down this transmission. We feel like we're at a tipping point, and right now it feels like the tipping point is dangerous for the community.
Very good. Lots of people worry that, and there's been some rumors about being able to spread it between your pets, your dogs, your cats. Is that just a nice internet rumor, or is there some truth to that?
I would say that is a tremendously rare way to have it. The pet, I suppose, could be a fomite, so you could. If somebody touched the dog and you touch the dog, so good hand washing again before and after, all that is the key. The dog getting it primarily and transferring is going to be, that's not really a concern.
Yeah, those types of rumors kind of flow, and it kind of makes you smile a little bit during this crisis. Now, lots of us are balancing the need to care for elderly at this time point. And
right.
What would be your advice? I'm going to go personal here and say that I have a father who's at his own home and he's well right now. Should I visit?
No, I don't think you should. Not in the heart of this. I think, people have to provide care for their family, and there's sometimes it's not possible not to visit. Then you want to follow precautions. I think wearing a mask in that situation, good hand washing. It's not a magic virus. It doesn't flow through stuff. So as long as you follow the right precautions and do the right amount of hand washing, you can protect yourself.
That's good to know. I think we worry about that for our children as well, that children, there's been new reports that we thought for a while that children were a little bit immune, but there seems to be some new reports that they too can get it, and maybe more severe than we thought.
Yeah, I think that is an important point. I mean, certainly children are handling this better than the elderly, but we are seeing across the country and even locally, it's not all 70 above people that are getting sick. There's younger people that get sick with this too. So people that think that they're immune to this, that there's no such thing. I think everybody has to be careful. It's not to be taken lightly at this point. This is a true crisis.
When we listen to the news and we hear about what's happening overseas, what do you think? What are you doing? What lessons are you learning from overseas that you are maybe applying here?
Well, I think that where we are now, the strict social isolation is our best bet to try to slow down the spread. It's in the community. We're going to see cases, and it's probably going to get worse before it gets better. But how much worse is going to be the key. If we can flatten that curve out, we'll have a chance as a healthcare system to try to keep up. If people don't do what they're supposed to be doing, and we can't flatten that curve, I think that has a lot of us worried in the healthcare community.
Do you have an idea of how long you think this is going to be a healthcare crisis? Are you thinking 2, 4, 6 weeks? Is that a fair question?
I'm not going to even venture a guess. Okay. I have no idea.
Okay.
I've heard different opinions. I think it all depends. So I would say it's probably going to be with us for a while.
Well, Doctor, thank you for taking time out of your busy day to give us a little insight. We wish you well.
No worries. Happy to do it.
And we thank the folks over at Edward and all the healthcare professionals who are taking their time to care for us and putting their lives at risk. So thank you.
I appreciate that.
Take care.
Take care. Bye-bye.
Bye-bye.